Question 1. When planning discharge teaching for a young adult, the nurse should include the potential health problems common in this age group. What should the nurse include in this teaching plan? A. Kidney dysfunction. B. Cardiovascular diseases. C. Eye problems, such as glaucoma. D. Accidents, including their prevention. The correct answer. D. Accidents, including their prevention. The rationale. Accidents are common during young adulthood because of immature judgment and impulsivity associated with this stage of development. Question 2. What principle of teaching specific to an older adult should the nurse consider when providing instruction to such a client recently diagnosed with diabetes mellitus? A. Knowledge reduces general anxiety. B. Capacity to learn decreases with age. C. Continued reinforcement is advantageous. D. Readiness of the learner precedes instruction. The correct answer, C. Continued reinforcement is advantageous. The rationale. Neurologic aging causes forgetfulness and a slower response time. Repetition increases learning. Question 3. A 76-year-old male client asks the nurse about the chances of getting osteoporosis like his wife. Which is the best response by the nurse? A. This is only a problem for women. B. Exercise is a good way to prevent this problem. C. You are not at risk because of your small frame. D. You might think about having a bone density test. The correct answer, D. You might think about having a bone density test. The rationale. Osteoporosis is not restricted to women, it is a potential major health problem of all older adults. Estimates indicate that half of all women have at least one osteoporotic fracture, and the risk in men is estimated between 13% and 25%. A bone mineral density, BMD, measurement assesses the mass of bone per unit volume or how tightly the bone is packed. Question 4. What is the priority when working with a group of middle-aged adult clients? A. Cessation of smoking. B. Prevention of infection. C. Abstinence from alcohol. D. Decreasing high-density lipoproteins levels. The correct answer, A. Cessation of smoking. The rationale. Smoking is a major risk factor for cardiovascular disease and hypertension, major health problems of middle-aged adults. Question 5. Which factor does the nurse consider most likely contributes to the increased incidence of hip fractures in older adults? A. Carelessness. B. Fragility of bone. C. Sedentary existence. D. Rheumatoid diseases. The correct answer, B. Fragility of bone. The rationale. Bones become more fragile because of loss of bone density associated with the aging process. This often is associated with lower circulating levels of estrogens or testosterone. Question 6. Which age-related change should the nurse consider when formulating a plan of care for an older adult? Select all that apply. A. Difficulty in swallowing. B. Increased sensitivity to heat. C. Increased sensitivity to glare. D. Diminished sensation of pain. E. Heightened response to stimuli. The correct answer, C and D. The rationale. C. Changes in the ciliary muscles, decrease in pupil size, and a more rigid pupil sphincter contribute to an increased sensitivity to glare. D. This may make an older individual unaware of a serious illness, thermal extremes, or excessive pressure. Question 7. A nurse is caring for an older adult with a hearing loss secondary to aging. What can the nurse expect to identify when assessing this client? Select all that apply. A. Dry cerumen. B. Tears in the tympanic membrane. C. Difficulty hearing women's voices. D. Decrease of hair in the auditory canal. E. Overgrowth of the epithelial auditory lining. The correct answer, A and C. The rationale. A. Cerumen, earwax, becomes drier and harder as a person ages. C. Generally, female voices have a higher pitch than male voices. Older adults with presbycusis, hearing loss caused by the aging process, have more difficulty hearing higher pitched sounds. Question 8. A 93-year-old client in a nursing home has been eating less food during mealtimes. What is the priority nursing intervention? A. Substitute a supplemental drink for the meal. B. Spoon-feed the client until the food is completely eaten. C. Allow the client a longer period of time to complete the meal. D. Arrange a consultation for the placement of a gastrostomy tube. The correct answer, C. Allow the client a longer period of time to complete the meal. The rationale. Aged clients may display psychomotor retardation and need more time to complete the tasks associated with the activities of daily living. Mealtimes should be relaxing and social. Question 9. A 78-year-old client who has hypertension is beginning treatment with furosemide, Lasix. Considering the client's age, what should the nurse teach the client to do? A. Limit fluids at bedtime. B. Change position slowly. C. Take the medication between meals. D. Assess the skin for breakdown daily. The correct answer, B. Change position slowly. The rationale. With aging there is a decreased vasomotor response and diminished elasticity of blood vessels that do not respond quickly to changes from horizontal to vertical. Orthostatic hypotension may occur. Changing position slowly allows the body to adjust, which prevents dizziness and loss of balance. Question 10. A nurse must obtain a client's apical pulse. Place an X over the site where the nurse should place the stethoscope. The correct answer. The heart's apex is between the 5th and 6th ribs at the midclavicular line. It is closest to the chest wall here, so auscultation is easier. Question 11. Which client's statement indicates an understanding of the nurse's instructions concerning a Holter monitor? A. The only times the monitor should be taken off is for showering and sleep. B. The monitor will record my activities and symptoms if an abnormal rhythm occurs. C. The results from the monitor will be used to determine the size and shape of my heart. D. The monitor will record any abnormal heart rhythms while I go about my usual activities. The correct answer, D. The monitor will record any abnormal heart rhythms while I go about my usual activities. The rationale. The cardiac rhythm is monitored and rhythm disturbances documented. Disturbances are stored, printed, and then analyzed in relation to the client's activity or symptom diary. Question 12. A client with a history of dysrhythmias is to wear a Holter monitor for 24 hours on an outpatient basis. What should the nurse teach the client to do while wearing the monitor? A. Discontinue medications. B. Avoid using a microwave oven. C. Keep a written account of activities. D. Record the blood pressure periodically. The correct answer, C. Keep a written account of activities. The rationale. A day's activities should be recorded so that they can be compared with the occurrence of dysrhythmias. Question 13. A client with a dysrhythmia is admitted to telemetry for observation. In the morning the client asks for a cup of coffee. What is the nurse's best response? A. Hot drinks such as coffee are not good for your heart. B. Coffee is not permitted on the diet that was ordered for you. C. You cannot have coffee. I can bring you a cup of tea if you like. D. Coffee has caffeine that can affect your heart. It should be avoided. The correct answer, D. Coffee has caffeine that can affect your heart. It should be avoided. The rationale. Caffeine is a stimulant that causes vasoconstriction and is contraindicated for a client with a dysrhythmia. Question 14. A client who had several episodes of chest pain is scheduled for an exercise electrocardiogram. Which explanation should the nurse include when teaching the client about this procedure? A. This is a non-invasive test to check your heart's response to physical activity. B. This test is the definitive method to identify the actual cause of your chest pain. C. The findings of this test will be of minimal assistance in the treatment of angina. D. The findings from this minimally invasive test will show how your body reacts to exercise. The correct answer, A. This is a non-invasive test to check your heart's response to physical activity. The rationale. This test evaluates the heart's ability to meet the need for additional oxygen in response to the stress of exercising. Changes in the ECG identify dysrhythmias and ST changes indicative of myocardial ischemia. Question 15. A client is admitted with chest pain unrelieved by nitroglycerin, an elevated temperature, decreased blood pressure, and diaphoresis. A myocardial infarction is diagnosed. Which should the nurse consider as a valid reason for one of this client's physiologic responses? A. Parasympathetic reflexes from the infarcted myocardium cause diaphoresis. B. Inflammation in the myocardium causes a rise in the systemic body temperature. C. Catecholamines released at the site of the infarction cause intermittent localized pain. D. Constriction of central and peripheral blood vessels causes a decrease in blood pressure. The correct answer, B. Inflammation in the myocardium causes a rise in the systemic body temperature. The rationale. Temperature may increase within the first 24 hours as a result of the inflammatory response to tissue destruction and persist as long as a week. Question 16. What must the nurse do to determine a client's pulse pressure? A. Multiply the heart rate by the stroke volume. B. Subtract the diastolic from the systolic reading. C. Determine the mean blood pressure by averaging the two. D. Calculate the difference between the apical and radial rate. The correct answer, B. Subtract the diastolic from the systolic reading. The rationale. Pulse pressure is obtained by subtracting the diastolic from the systolic reading after the blood pressure has been recorded. Question 17. After surgery for insertion of a coronary artery bypass graft, CABG, a client develops a temperature of 102 degrees Fahrenheit 38.8 degrees Celsius. What priority concern related to elevated temperatures does a nurse consider when notifying the healthcare provider about the client's temperature? A. A fever may lead to diaphoresis. B. A fever increases the cardiac output. C. An increased temperature indicates cerebral edema. D. An increased temperature may be a sign of hemorrhage. The correct answer, B. A fever increases the cardiac output. The rationale: temperatures of 102 degrees Fahrenheit 38 degrees Celsius or greater lead to an increased metabolism and cardiac workload. Question 18. A nurse is teaching a group of clients with peripheral vascular disease about a smoking cessation program. Which physiologic effect of nicotine should the nurse explain to the group? A. Constriction of the superficial vessels dilates the deep vessels. B. Constriction of the peripheral vessels increases the force of flow. C. Dilation of the superficial vessels causes constriction of collateral circulation. D. Dilation of the peripheral vessels causes reflex constriction of visceral vessels. The correct answer, B. Constriction of the peripheral vessels increases the force of flow. The rationale: constriction of the peripheral blood vessels and the resulting increase in blood pressure impair circulation and limit the amount of oxygen being delivered to body cells, particularly in the extremities. Question 19. During an interview, the nurse discovers that the spouse of a debilitated, chronically constipated client digitally removes stool from the client's rectum. What response to disimpaction is the nurse attempting to prevent by presenting other strategies to regulate the client's bowel movements? A. Increased pulse rate. B. Slowing of the heart. C. Dilation of the bronchioles. D. Coronary artery vasodilation. The correct answer, B. Slowing of the heart. The rationale: disimpaction can cause vagal stimulation, which slows the heart. The vagus is the principal nerve of the parasympathetic portion of the autonomic nervous system, and its axon terminals release acetylcholine. The response of the viscera to acetylcholine varies, but in general the organ is in a relaxed state. Question 20. A nurse is assessing the legs of a client with a history of chronic venous insufficiency. What physiologic changes should the nurse conclude are the result of this disease process? Select all that apply. A. Stasis ulcer. B. Necrotic tissue. C. Ecchymotic areas. D. Diminished pulses. E. Brown discoloration. The correct answer, A and E. The rationale: A. Stasis ulcers result from edema or minor injury to the limb, they frequently form over the medial malleolus, inner ankle. E. The release of iron from hemoglobin as erythrocytes disintegrate in tissue results in ferrous sulfide formation, causing darkening of the tissues. Question 21. A nurse is caring for a client with chronic occlusive arterial disease. What precipitating cause is the nurse most likely to identify for the development of ulceration and gangrenous lesions? A. Emotional stress, which is short-lived. B. Poor hygiene and limited protein intake. C. Stimulants such as coffee, tea, or cola drinks. D. Trauma from mechanical, chemical, or thermal sources. The correct answer, D. Trauma from mechanical, chemical, or thermal sources. The rationale: diminished sensation decreases awareness of injury. Injured tissue cannot heal properly because of cellular deprivation of oxygen and nutrients, ulceration and gangrene may result. Question 22. A client is prescribed prolonged bed rest after surgery. Which complication does the nurse expect to prevent by teaching this client to avoid pressure on the popliteal space? A. Cerebral embolism. B. Pulmonary embolism. C. Dry gangrene of a limb. D. Coronary vessel occlusion. The correct answer, B. Pulmonary embolism. The rationale: The pulmonary capillary beds are the first small vessels that the embolus encounters once it is released from the calf veins. Question 23. A nurse in the post-anesthesia care unit is caring for a client who received a general anesthetic. Which finding should the nurse report to the healthcare provider? A. Client pushes the airway out. B. Client has snoring respirations. C. Respirations of 16 breaths per min are shallow. D. Systolic blood pressure drops from 130 to 90 mm of mercury. The correct answer, D. Systolic blood pressure drops from 130 to 90 mm mercury. The rationale. A drop in blood pressure, rapid pulse rate, cold, clammy skin, and oliguria are signs of decreased blood volume and shock, which if not treated promptly can lead to death. Question 24. After abdominal surgery, a client suddenly reports numbness in the right leg and a funny feeling in the toes. What should the nurse do first? A. Elevate the legs and tell the client to drink more fluids. B. Instruct the client to remain in bed and notify the healthcare provider. C. Rub the client's legs to stimulate circulation and cover the client with a blanket. D. Tell the client about the dangers of prolonged bed rest and encourage ambulation. The correct answer, B. Instruct the client to remain in bed and notify the healthcare provider. The rationale. Localized sensory changes may indicate nerve damage, impaired circulation, or thrombophlebitis. Activity should be limited and the healthcare provider notified. Question 25. After a bilateral lumbar sympathectomy, a client has a sudden drop in blood pressure, but there is no evidence of bleeding. What should the nurse identify as the most likely cause of the change in blood pressure? A. Inadequate fluid intake. B. Consequence of anesthesia. C. Increased level of epinephrine. D. Reallocation of the blood supply. The correct answer, D. Reallocation of the blood supply. The rationale. A sympathectomy causes dilation of the blood vessels in the lower extremities. The resulting shift in the blood volume lowers the systemic blood pressure. Question 26. A nurse inspects a 2-day-old intravenous site and identifies erythema, warmth, and mild edema. The client reports tenderness when the area is palpated. What should the nurse do first? A. Irrigate the IV tubing. B. Discontinue the infusion. C. Slow the rate of the infusion. D. Obtain a prescription for an analgesic. The correct answer, B. Discontinue the infusion. The rationale. The clinical findings indicate the presence of inflammation. The intravenous catheter should be removed to prevent the development of thrombophlebitis. Question 27. While convalescing from abdominal surgery, a client develops thrombophlebitis. Which clinical indicators of this complication should the nurse expect to identify when assessing the client? Select all that apply. A. Pain in the calf. B. Intermittent claudication. C. Redness in the affected area. D. Pitting edema of the lower leg. E. Ecchymotic areas around the ankle. F. Localized warmth in the lower extremity. The correct answer, A, C, and F. The rationale. A. Pain is related to the edema associated with the inflammatory response. C. Redness is related to vasodilation and the inflammatory response. F. Thrombophlebitis is inflammation of a vein that occurs with the formation of a clot. Warmth is related to vasodilation. Question 28. A client who had surgery 24 hours ago reports pain in the calf. Assessment reveals redness and swelling at the site of discomfort. What should the nurse do? A. Keep both legs dependent. B. Notify the healthcare provider. C. Apply a warm soak to the left calf. D. Administer the prescribed analgesic. The correct answer, B. Notify the healthcare provider. The rationale. The clinical findings indicate a possible thrombophlebitis. Bed rest with the legs elevated should be maintained and the healthcare provider notified immediately. A thrombus may progress to a pulmonary embolus. Question 29. A nurse is assessing arterial perfusion in a client who had surgery with placement of a graft for an aneurysm in the left femoral artery. Place an X in the illustration over the site of the pulse that should be assessed to determine maximum arterial perfusion distal to the operative site. The correct answer. The pulse most distal to the graft should be assessed first to determine adequacy of circulation. The pedal pulse is located on the top of the foot and is the most distal peripheral pulse. Question 30. A nurse is teaching a client about the use of anti-embolism stockings. What instruction should the nurse include? A. Keep the stockings on 2 hours and off 2 hours. B. Wear the stockings only at bedtime when activity lessens. C. Put the stockings on before getting out of bed in the morning. D. Leave the stockings in place until the healthcare provider advises otherwise. The correct answer, C. Put the stockings on before getting out of bed in the morning. The rationale. Support hose apply external pressure on the veins, preventing the retrograde pressure or flow that may occur in the standing or sitting positions. Application before arising prevents the veins from having the opportunity to become engorged. Question 31. A healthcare provider orders thigh-high anti-embolism stockings for a client with varicose veins. The client's thighs are heavier than the lower legs, and the stockings fit on the lower leg but are causing discomfort and indentations on the upper thighs. What should the nurse do? A. Replace the thigh-high stockings with knee-high stockings. B. Leave the anti-embolism stockings off to prevent tissue damage. C. Roll the top of the stockings to below the knees to limit popliteal pressure. D. Ask the healthcare provider if an elastic bandage can be used in place of the stockings. The correct answer, D. Ask the healthcare provider if an elastic bandage can be used in place of the stockings. The rationale. An elastic bandage can be adjusted to the varying proportions of the client's legs. Question 32. What should the nurse teach a client who is taking antihypertensives to do to minimize orthostatic hypotension? A. Wear support hose continuously. B. Lie down for 30 minutes after taking medication. C. Avoid tasks that require high energy expenditure. D. Sit on the edge of the bed for 5 minutes before standing. The correct answer, D. Sit on the edge of the bed for 5 minutes before standing. The rationale. Sitting on the edge of the bed before standing up gives the body a chance to adjust to the effects of gravity on circulation in the upright position. Question 33. A client being treated for hypertension reports having a persistent hacking cough. What class of antihypertensive should the nurse identify as a possible cause of this response when reviewing a list of this client's medications? A. ACE inhibitors. B. Thiazide diuretics. C. Calcium channel blockers. D. Angiotensin receptor blockers. The correct answer, A. ACE inhibitors. The rationale. ACE, angiotensin-converting enzyme, increases the sensitivity of the cough reflex, leading to the common adverse effects sometimes referred to as an ACE cough. Question 34. What client response indicates to the nurse that a vasodilator medication is effective? A. Pulse rate decreases from 110 to 75. B. Absence of adventitious breath sounds. C. Increase in the daily amount of urine produced. D. Blood pressure changes from 154/90 to 126/72. The correct answer, D. Blood pressure changes from 154/90 to 126/72. The rationale. Vasodilation will lower the blood pressure. Question 35. What should the nurse assess to determine if a client is experiencing the therapeutic effect of valsartan, Diovan? A. Lipid profile. B. Apical pulse. C. Urinary output. D. Blood pressure. The correct answer, D. Blood pressure. The rationale. Angiotensin II receptor blockers, ARBs, lower the blood pressure. They block the receptor sites in smooth muscles and adrenal glands so vasoconstriction is prevented. Question 36. What information should the nurse include when teaching a client with heart disease about cholesterol? A. Can be found in both plant and animal sources. B. Causes an increase in serum high-density lipoprotein. C. Should be eliminated because it causes the disease process. D. Decreases when unsaturated fats are substituted for saturated fats. The correct answer, D. Decreases when unsaturated fats are substituted for saturated fats. The rationale. Cholesterol is a sterol found in tissue. It is attributed in part to diets high in saturated fats. Question 37. Which instructions should the nurse include in the teaching plan for a client with hyperlipidemia who is being discharged with a prescription for cholestyramine, Cas-Tran? A. Increase your intake of fiber and fluid. B. Take the medication before you go to bed. C. Check your pulse before taking the medication. D. Contact your healthcare provider if your skin or sclera turn yellow. The correct answer, A. Increase your intake of fiber and fluid. The rationale. Fiber and fluids help prevent the most common adverse effect of constipation and its complication, fecal impaction. Question 38. A nurse is providing dietary instruction to a client with cardiovascular disease. Which dietary selection by the client indicates the need for further instruction? 1 whole milk with oatmeal. 2 garden salad with olive oil. 3 tuna fish with a small apple. 4 soluble fiber cereal with skim milk. The correct answer, A. Whole milk with oatmeal. The rationale. Although oatmeal is a soluble fiber, whole milk is high in saturated fat and should be avoided. Question 39. A nurse asks a client with ischemic heart disease to identify the foods that are most important to restrict. The nurse determines that the client understands the dietary instructions when the client identifies the following foods. Select all that apply. A. Olive oil. B. Chicken broth. C. Enriched whole milk. D. Red meats, such as beef. E. Vegetables and whole grains. F. Liver and other glandular organ meats. The correct answer, B. C, D, and F. The rationale. B. This is high in sodium and should be avoided to prevent fluid retention and an elevated blood pressure. C. This is high in saturated fats and contributes to hyperlipidemia, skim milk is the healthier choice. D. These are high in saturated fats and should be avoided. F. These are high in cholesterol and should be avoided. Question 40. Which instructions should the nurse include in the teaching plan for a client who will be taking simvastatin, Zocor, when discharged? Select all that apply. A. Increase dietary intake of potassium. B. Avoid prolonged exposure to the sun. C. Schedule regular ophthalmic examinations. D. Take the medication at least a half hour before meals. E. Contact your healthcare provider if skin becomes gray bronze. The correct answer, B, C and E. The rationale. B. Simvastatin increases photosensitivity, the client should avoid sun exposure and use sunblock. C. The client should be monitored for the adverse effects of glaucoma and cataracts. E. Gray bronze skin and unexplained muscle pain are signs of rhabdomyolysis. Rhabdomyolysis, a life-threatening response, is the disintegration of muscle associated with myoglobin in the urine. Question 41. Which topic should the nurse determine is most appropriate when presenting health-related instruction to clients from an African American community? A. Osteoporosis. B. Hypertension. C. Uterine cancer. D. Thyroid disorders. The correct answer, B. Hypertension. The rationale. Hypertension is 78% more prevalent in African Americans than among Caucasian Americans. 30% of African Americans have hypertension. Question 42. Amlodipine, Norvasc, is prescribed for a client with hypertension. Which response to the medication should the nurse instruct the client to report to the healthcare provider? A. Blurred vision. B. Dizziness on rising. C. Excessive urination. D. Difficulty breathing. The correct answer, D. Difficulty breathing. The rationale. Dyspnea may indicate development of pulmonary edema, which is a life-threatening condition. Question 43. Atenolol, tenormin, 150 mg by mouth is prescribed for a client with hypertension. Each tablet contains 50 mg. How many tablets should the nurse administer? Record your answer using a whole number. The correct answer, 3 tablets. Use the desire over have formula of ratio and proportion to solve the problem. Question 44. What should the nurse identify as the primary cause of the pain experienced by a client with a coronary occlusion? A. Arterial spasm. B. Heart muscle ischemia. C. Blocking of the coronary veins. D. Irritation of nerve endings in the cardiac plexus. The correct answer, B. Heart muscle ischemia. The rationale. Ischemia causes tissue injury and the release of chemicals, such as bradykinin, that stimulate sensory nerves and produce pain. Question 45. What instructions about the use of nitroglycerin should the nurse provide to a client with angina? A. Identify when pain occurs, and place 2 tablets under the tongue. B. Place 1 tablet under the tongue, and swallow another when pain is intense. C. Before physical activity place 1 tablet under the tongue, and repeat the dose in 5 minutes if pain occurs. D. Place one tablet under the tongue when pain occurs, and use an additional tablet after the attack to prevent recurrence. The correct answer, C. Before physical activity, place one tablet under the tongue, and repeat the dose in 5 minutes if pain occurs. The rationale: anginal pain, which can be anticipated during certain activities, may be prevented by dilating the coronary arteries immediately before engaging in the activity. Question 46. Which nursing action is most important when caring for a client after a cardiac catheterization? A. Provide for rest. B. Administer oxygen. C. Check a pulse distal to the insertion site. D. Assess the electrocardiogram every 15 minutes. The correct answer, C. Check a pulse distal to the insertion site. The rationale: the pulse should be assessed because the trauma at the insertion site may interfere with blood flow distal to the site. There is also danger of bleeding. Question 47. For which common complication of myocardial infarction should the nurse monitor clients in the coronary care unit? A. Dysrhythmia. B. Hypokalemia. C. Anaphylactic shock. D. Cardiac enlargement. The correct answer, A. Dysrhythmia. The rationale: myocardial infarction, MI, may cause increased irritability of tissue or interruption of normal transmission of impulses. Dysrhythmias occur in about 90% of clients after an MI. Question 48. A nurse prepares a client for insertion of a pulmonary artery catheter. What information can be obtained from monitoring the pulmonary artery pressure? A. Stroke volume. B. Venous pressure. C. Coronary artery patency. D. Left ventricular functioning. The correct answer, D. Left ventricular functioning. The rationale: the catheter is placed in the pulmonary artery. Information regarding left ventricular function is obtained when the catheter balloon is inflated. Question 49. A client with a thromboembolic disorder is receiving a continuous intravenous infusion of heparin 1000 units per hour. There are 25,000 units of heparin in 500 ml of 5% dextrose solution. At how many milliliters per hour should the nurse set the rate on the electronic infusion control device? Record your answer using a whole number. The correct answer, 20 milliliters per hour. Use desire over have formula of ratio and proportion to solve the problem. Question 50. An older adult with cerebral arteriosclerosis is admitted with atrial fibrillation and is started on a continuous heparin infusion. What clinical finding enables the nurse to conclude that the anticoagulant therapy is effective? A. A reduction of confusion. B. An APPT twice the usual value. C. An absence of ecchymotic areas. D. A decreased viscosity of the blood. The correct answer, B. An appointment twice the usual value. The rationale: desired anticoagulant effect is achieved when the activated partial thromboplastin time is 1.5 to 2 times normal.